Hello, everyone. Welcome back to the Student Arts Network. Uh, we're here today to do another Student Presents. Today, we have a topic about compounding pharmacy and sterile compounding presented by our very own producer, Shideh. So first of all, would you like to introduce yourself first?
Thank you so much for having me, Ryan. I really admire everything you're doing for the community, for pharmacists, for students, and it's a pleasure to be here. My name is Shideh Sharifi, and I'm a Doctor of Pharmacy candidate from Chapman University here in Irvine, California. I also have a Bachelor's in Science and Chemistry from University of North Texas. I also do NFT and digital art on the side, and I have been a pharmacy technician in compounding since 2013.
Great. So first of all, consider the vast experience you have. Would you mind telling our audience, like, what is compounding pharmacy exactly, or what is the compounding practice of it? Because I do know that different pharmacies, they have something called sterile or non-sterile compounding. It can be practiced in di various different settings. So would you just briefly talk about that?
That's a wonderful question. So yeah, let's start with your first question. What is compounding? And basically, compounding practice refers to a process of customizing a product for the consumer. Most likely, it's going to be pharmaceutical products, but it doesn't necessarily basically get um, degraded down to just pharmaceutical products. And it's going to be a variety of medications and other basically products as well. So what we can start with is compounding is basically done when patients need a specific dosage or form of medication and it is not commercially available. Let's say someone needs a basically form of liquid and they cannot take a capsule or swallow any pills. That's when compounding comes in. Or basically when a patient is allergic to what is commercially available. We saw that a lot in 503B compounding, which we will go over later, as a compounding, basically injectable, has a base of cottonseed oil, and the patient is allergic to that. We will switch that with another oil where the patient is not allergic to. Some other forms of compounding are going to be flavoring that we add for geriatric or pediatric patients. And hormone replacement therapy is another example that I can give you, which we need very specific ingredients and amounts of ingredients for each patient tailored to their needs. So some other forms of compounded products are going to be nutritional supplements, cosmetics, veterinary products and compounds, dental compounding, some transdermal patches, suppositories, lozenges, and those forms of drugs.
Perfect. So again, as you suggest, right, these kind of ingredients is in a pharmaceutical product have various different functions, or sometimes patient might have specific needs to these products. So in different settings, right, what makes a compounded product high versus low risk? As you kind of suggested, some of them are just maybe like topicals or like oral form medications. Some of them are more for injectables. Uh, I was assume that, for the injectable medications, there needs to be a certain regulation on how to make sure it's sterile or make sure it's clean, um, all sorts of things like that. So would you like just briefly talk about that as well?
Absolutely. So a product is high versus low risk depending on several factors. Some of the factors that we can go over is firstly the number of ingredients. So most likely a low risk medication or low risk compounded product has two or sometimes three ingredients, but preferably one or two, meaning you have a vial of powder and it is sterilized already. You're going to reconstitute it and get the concentration that you need and just add that powder into, let's say, a bag of NS. So that's going to be one to two ingredients, like we mentioned. Then, if we have more than two or three ingredients, that's when it is most likely basically considered a high risk medication. So another factor that's going to affect whether a product is high or low risk is going to be the nature of the ingredients. So the low risk sterile products basically are already sterile, just like the previous example that we gave. the powder in the vial is already sterilized, so you don't need to technically sterilize it again. You just need to use aseptic and sterile technique to add it into another sterile to have a final product. But a high risk sterile medication is going to have non-sterile powders or some form of non-sterile ingredient that you need to change and alter and sterilize in order for it to be available for use for the consumer. The third topic that we want to go over, which is one of the factors that determines whether a product is high or low risk, is going to be the complexity of the process. Again, like we mentioned, low-risk products involve very simple manipulation, and they're performed very easily in the ISO class 5, which is going to be your laminar workflow or airflow bench, or your horizontal workflow bench. But a high-risk compounding injectable solution is usually made from a bulk powder or bulk basically ingredient container, and you're going to take from the bulk powder, you're going to take from the bulk ingredients, and you're going to mix the amount that you need and then perform the sterilization process. The fourth is going to be the environmental controls. So in order for us to, for example, compound, let's say, chemotherapy medications, right? We need to complete that process in a negative pressure room. And the reason is the environmental control is set up in a way where it is to protect the patient as well as the personnel who's compounding it. The negative air pressure is going to take all of the particles and the powders upwards, and it's going to suck it up so it does not sit on your clothing and it does not sit on the product, the end product, and all those things. Lastly is beyond use date. Low risk medications and low risk compounded products have shorter beyond use dates. By example, if you're just adding a powder to your basically bag of still water or dextrose, by example, it's only going to be good for sometimes 1 day, sometimes 5 days, depending on the ingredients that you use. But in high-risk medications where you are creating an injectable or you're creating an inhaler solution or eye drops, depending on the ingredients that you're using and the testing that the facility has done, you can basically increase it beyond use date up to 3 months or 6 months at times. So that's going to be the main difference. We'll go over it once again. It's going to be the number of ingredients, the nature of the ingredients, complexity of the process, environmental controls, and the beyond use date.
Great, perfect. I know you introduced a lot of ideas right there, and I really do appreciate the details that's put into it. Just to kind of go back a little bit on, expressing maybe defining some key terms in compounding pharmacy. One thing that I'm particularly curious that I feel like we can definitely mention about is the ISO class 5 environment or any ISO class environment. Would you mind briefly discussing about that? It doesn't need to be in detail. I know there's like a calculation in regards to how many how many substance or microbiome materials are in a certain environment, but we can just briefly go over what's defined as like ISO classes.
Absolutely. So basically, you start with the ISO class 8. That's when everything that is non-sterile is mainly basically compounded. And then ISO class 7 is going to be where you, it's your empty room, where you garb up, you get ready, and you basically take everything that you need to take into the ISO 5, where you can actually compound, which is inside of your hood. The hood has basically a filtration process of the air. And also, like we mentioned before, different hoods have different functions, and they basically sterilize the air where you are performing the compounding. So it's in the amount of particles, like you mentioned, and how many particles per minute the exchange of air and taking out of the debris is being performed by the hood and by the room. And that's what makes a different setting available for us to perform different functions in.
Perfect. Again, I really appreciate you explaining that. I know that, as you were mentioned, right, within a compounding facility, there's multiple rooms, that is kind of like also dictates kind of the workflow, of how sterile compounding works, in particularly. So, with all these different concerns, right? Maybe you can talk a little bit about, the requirements of sterile compounding and what's the main difference between sterile and non-sterile, especially in regards to, USP, regulation wise.
Yeah, that's a wonderful question. So let's start with the regulations briefly. So basically, since I believe it's the 1961, if I'm not wrong, based on several disastrous events that occurred and a lot of patients that got hurt in different parts of the world, the U.S. basically put in place the U.S. Pharmacopoeia or the USB. And this basically provides standards and guidelines for compounding practices. And it's particularly in chapters USB 795, which is for non-sterile compounding, the USB 797, which is for sterile compounding, and 800, which is for handling hazardous drugs. And that's when they started building these rooms where you can perform hazardous medication compounding, chemotherapy medication compounding, and so on and so forth. So the main difference between sterile and non-sterile, let's go over that real quick. Basically, sterile medications are free of contamination, free of debris, and they're appropriate for intravenous injection use. So they can be used to go inside of the veins, inside of the body, intramuscular, intravenous, as well as intranasally and into the eyes as well. So all of those medications that are used have to be sterilized prior to dispensing. And some of the things that they have to be free of is going to be microorganisms, which makes it aseptic, basically. So it's going to be bacteria, viruses, fungi, and other pathogens that cause infections. Another thing that they have to be free of is going to be endotoxins and pyrogens. Pyrogens are very easy to get rid of because you cannot filter them. So in a compounding pharmacy, if you are using beakers, they have to be depyrogenated, meaning you have to rinse them with water, sterile water, which is clean and also free of debris. And then you have to incubate those beakers and those glass jars or vials that you're using into an autoclave, which will use heat to get rid of all the pyrogens because there's no other way to filter or kill pyrogens. And if there are harmful pyrogens in any compounded product, it's going to cause fever and other things in the body. Another form of basically making sure that there's nothing in a compounded product is going to be getting rid of the particulate matters, such as the dust, the fibers, and the foreign materials that might be in the medication or the powder that you're using. Chemical contaminants and impurities that are on top of the equipment or handling the raw material that also have to be gone rid of. And residual solvents, those also have to be filtered and made sure that they are sterile prior to use. Some of the solvents are going to be benzyl alcohol, which is for the stability and for the duration of use for the medication, or hydrochloric acid and sodium hydroxide, which are used to basically adjust the pH of a medication. And cross-contamination is the last one that I have on my list that we need to ensure is not occurring for any sterile medications. Now let's go to non-sterile medications. Some people may think that sterile medication, non-sterile medications can be created and compounded just anywhere, but they also have to be performed in a designated area within the pharmacy. And they also have to be free of contamination. They're not sterile, but there shouldn't be any microbial contaminants. There shouldn't be any particulate matters or any chemical contaminants, as well as residual solvents that we went over previously. And any cross-contamination has also have to also be accounted for. You cannot make something that has T3 where you are making something that has progesterone in it. So cross-contamination is also a big issue in compounding pharmacies, and it applies to both sterile and non-sterile products.
Thank you.